Well, if there is someone who you really care for, deeply love, your near and dear one is suffering from blood pressure, kidney problems, or any heart diseases, then yes, they might be under CaReMe diseases. So, what are CaReMe diseases? Could you please help us understand in detail?
CaReMe stands for, let me clear at the outset itself. CA stands for cardiological disorders. RE stands for renal problems, and ME stands for metabolic problems. That includes diabetes mellitus also. We have about 140 million kidney problem patients in our country,
Oh my God.
and about 220 million hypertensives in our country. You just imagine, if you see some people going on the road, 1 out of 3 in adults is likely to have hypertension.
How does one come across that they might have an issue with the kidney for those who have not realized it yet?
Yeah, the kidney disease unfortunately is a very silent condition. So unless you look for it, at least especially in the earlier stages, kidney disease progresses through 5 stages, and until you come to the 4th or the 5th stage, it is really silent. So how do you know that this person in my family or myself is having kidney disease? We have to go to the laboratory, get the test done.
India is the largest capital in the world who has diabetes patients. But sir, I have a doubt and a question here. How to avoid it in the very beginning stage? How does one even realize that they are prone to diabetes?
Diabetes also can be silent. Yes, most of the times, all of our experience say that they come for something else. So we detect the diabetes. The one statistics is so interesting. 33% of the individuals who walk into the endocrinologist clinic or so-called diabetologist clinic, they are all diabetics.
But doctors, before we wrap up, we would like to ensure that our listeners get one piece of advice on how one can take care and ensure that they are free from CaReMe diseases. Hello and welcome to this special podcast on CaReMe diseases. If you're wondering what CaReMe diseases are, then I request you all to kindly stick on till the end of the podcast. Well, if there is someone who you really care for, deeply love, your near and dear one is suffering from blood pressure, kidney problems, or any heart diseases, then yes, they might be under CaReMe diseases. So, if you want to know more details about these CaReMe diseases, they are cardiovascular, renal and metabolic conditions. And to give us more insights about this, we have the industry experts here with us. So I would like to introduce you all to Dr. Narendra J, who is a heart specialist. Welcome, sir.
Yeah.
We also have Dr. Anupama YJ, a kidney expert out here. So welcome, ma'am. And we also have Dr. Ratnakar, diabetes and metabolism specialist. So welcome, sir.
Thank you.
So, Dr. Narendra,
Yeah.
I have a question for you out here. So, what are CaReMe diseases? Could you please help us understand in detail?
Yeah. First, let me at the outset congratulate all the viewers and of course the listeners who will be hooking onto this program. And on behalf of my colleagues, Dr. YJ Anupama, who is a senior nephrologist, and our colleague Dr. Ratnakar, who is a senior physician and diabetic and metabolic specialist, I have a warm welcome for you all. So it's all with respect to CaReMe disease, and of course I also congratulate the organizing team which have actually conceptualized this particular CaReMe problems. CaReMe stands for, let me clear at the outset itself. CA stands for cardiological disorders. RE stands for renal problems, and ME stands for metabolic problems. That includes diabetes mellitus also. So first, let me give you an outlook as to what is the real problem or magnitude of the problem as far as we are facing in this particular country. As you know, as of today, our population in India is around 145 crores. That is a huge population, and it is the largest democratic country in this world. And we have, of course, a lot of problems with respect to lot of detection, lot of incidence and prevalence of diabetes mellitus, hypertension, cardiac problems, metabolic problems, so on and so forth. So just I will give you a real estimate of some of the real estimates of this problem. So we have about 80 million diabetic population in our country. We have about 140 million kidney problem patients in our country,
Oh my God.
and about 220 million hypertensives in our country. You just imagine if you see some people going on the road, 1 out of 3 in adults is likely to have hypertension. The whole problem is, although the magnitude is so much, these diseases are under-detected. Even though if they are detected, they are under-treated. So as a result, the magnitude of the problem is huge actually. So I can say that we are facing a real endemic of these epidemic problems, a real endemic of the huge problem of diabetes mellitus, then hypertension, then kidney problems, then metabolic problems, all these things. It's not just knowing the incidence or the prevalence or the magnitude of the problem. What these are doing actually, the so-called CaReMe diseases are actually how they are troubling our country. So all these diseases are hugely associated with significant mortality, that is loss of lives, and significant morbidity, that is loss of quality of life. So both of them are affected actually. So somebody has to take care of the patient. So we have to spend huge amounts of money. And another real added problem is almost younger generation. In the second or third decade, we have started seeing obesity, hypertension, diabetes, heart attacks, so on and so forth. So you can imagine if the young population of a country is sick, you can imagine the problem of the older people in this particular country.
Yes.
So in this background, we have actually got some message to the viewers as the listeners from our side. As industrial specialists, means we are not specialists actually, we are consultant clinicians. We are almost practicing cardiology, nephrology, and of course metabolic syndromes with respect to diabetes mellitus for the last, I think, 3 decades. We have all very good experience. So in this background, I will just give you an overall view as to what is about this particular, why all these 3 disease conditions, so-called the disease of the heart, disease of the kidneys, and the metabolic problems are interlinked actually. As you all know, elements are made up of atoms and molecules.
Yes.
Similarly, all human bodies are made up of ultimately the cells. So we have thousands and millions of cells. They join together to form tissues. Tissues join together to form organs. Organs join together to form organ systems. And ultimately, several organ systems will constitute our human body. This is the simplest way to understand how our human body is constructed or is maintained, and why these diseases are interlinked with one another. And remember, all these organ systems like cerebrovascular system, including the brain, then we have cardiovascular system, the heart and the blood vessels, then we have the pulmonary system where we have the lungs, of course, then we have the kidneys where we have renovascular disorders and renovascular systems, then our gastrointestinal system, genital, all these systems, they have one unique thing in that thing. They are all linked with 2 important pathways. One is neurons, that is the nerves. Second is the blood vessels. So as a result of this, all these organ systems are totally interconnected with one another. So a problem in one organ can lead to a problem in another organ.
Okay.
It is not that they are all totally independent, like a country wherein states are actually behaving in their own automatic way. So they are all linked with one another. So a problem in one can lead to a problem in another, or a health of one can lead to a health of another. So this is a very basic thing we have to keep in mind as we go through several aspects of these CaReMe diseases. So that is where I can say that this is an important topic we have selected actually, and real magnitude of the problem of this country are being discussed with this, so that we can give some tips as to take care of these different problems and see that the younger generation will live long and the older generations are also protected. So that's where I can actually hand over the things to you, Babak.
Okay. Thank you so much, Dr. Narendra, for giving us such a detailed insight on how this is such an important topic that needs to be discussed. So you were just mentioning about how we are all formed as humans, about the cell or the body parts, how they're all interlinked.
Yeah.
But if you think about it, heart is in a different position, the kidneys are in a different position, and diabetes is, or let's say the metabolism is all over in the body because it's from the head to the toe.
Yeah.
But here, not many people understand that they're all interlinked.
Yeah.
So as a heart expert, you just gave us an insight on what CaReMe diseases are. Now I would like to also understand on how the kidneys can also get affected with these CaReMe diseases. So ma'am, Anupama ma'am, we just heard from Dr. Narendra that CaReMe diseases, they're all interlinked. So as a kidney expert, what is your take on this, and what would you suggest to the patients whoever are facing these diseases?
So it is, as Dr. Narendra has already said, the kidney diseases are very much linked to the heart problems as well as the metabolic problems. It is the blood vessels which are actually, the kidneys are very vascular organs. Almost 1 liter of the heart's the blood volume
Wow.
is filtered every minute. So
Every
that much is
minute?
that much is working capacity of the kidneys. So you can imagine, when it is exposed to that much of blood, the blood pressure also gets transferred
Absolutely.
from the heart to the kidney, and a lot of diseases, the blood pressure related diseases can affect the kidneys also. In fact, kidneys and blood pressure are very intimately linked. One kidney diseases can lead to excessive blood pressure, and blood pressure on the other hand can also affect the kidneys. So it is a bi-directional relationship. And secondly, when it is coming to the metabolic problems also, diabetes is the most common condition which causes problems with the kidney.
Okay.
So almost about 30 to 40% of all diabetics have some kind of kidney diseases. If it is,
Are they aware of this, ma'am?
this is a very silent condition. So most people will not really understand it unless they go for the tests. Most people think that diabetes is a blood sugar problem. It is not
Yes.
related to, they don't understand the ramifications of that blood sugar problem. So that is how kidneys are interlinked. It is related to the metabolic problems, it is related to the cardiac problems, and in fact, that is why it is in the middle of that CaReMe syndrome.
Yes. Thank you so much, Dr. Anupama ma'am, for explaining us all these details on how a person who is facing any cardiovascular issue can also be facing an issue with their kidneys. But ma'am, you just mentioned that they might not be aware of it, and 30 to 40% of them might be experiencing some silent trauma, physical trauma with their kidneys. So, as an expert, how does one come across that they might have an issue with the kidney for those who have not realized it yet?
Yeah, the kidney disease unfortunately is a very silent condition. So unless you look for it, at least especially in the earlier stages, kidney disease progresses through 5 stages, and until you come to the 4th or the 5th stage, it is really silent. So how do you know that this person in my family or myself is having a kidney disease? We have to go to the laboratory, get the test done.
Okay.
So unless you look for the kidney disease, it is not very evident immediately.
Okay.
The symptoms and signs come later on.
Okay.
So that is a very, very important message that I would like to give to the listeners.
Okay. Thank you so much, Dr. Anupama ma'am, for giving us these insights. So, Dr. Ratnakar, we just heard Dr. Narendra, who gave us an inside detail about what CaReMe diseases are and the effect on the cardiovascular part. And we also heard from Dr. Anupama, where this is also affecting the kidneys and where patients do not realize it. And you, as a metabolism and a diabetes expert out here, what is your take on this, sir? Because metabolism and diabetes is something which people would realize pretty much fast, as that is from the head to toe, it's completely all over in your blood vessels. So to the patients, to the audience, to the listeners, what is your take on this?
Very nice question, because the whole CaReMe diseases are dependent on this particular aspect, what you call as metabolic status. For example, most of our villagers or the people who are really learned, they read the blood sugar values and forget it once it is under control. But it is not actually so. For example, at the diagnosis, yes, we all look into the total parameters of the patient, from blood sugar to kidney factor, heart factor, all the tests which are concerned with the metabolic health. But the day one, there may not be any damage. But over the course of time, there will be definitely the negative impact of a high blood sugar or fluctuation of the blood sugars, or the dysglycemia, what we call. So there is something called as age product, advanced glycated end product. How does it happen? It is whatever is sugar is not utilized in the body, or it is circulating in the blood, which interacts with the nucleic acid and lipids and form almost like, I can say, a toxic product, or it is a damaging product which acts on or interferes with the endothelial function. Endothelium is nothing but the layer inside the blood vessels which is all over the body. That is why wherever there is endothelium, the age products or advanced glycated end products will damage the endothelial cells, whether it is retina, whether it is heart, whether it is kidney, whether it is peripheral vascular disease or the peripheral vascular system or even the nerves. Wherever you go, endothelial damage is the main impact. Is it seen from the eyes? No. Is it seen from the investigations or the instruments? No. Then we have to check every system. For example, if I want to refer a patient of my diabetes patient to Dr. Narendra, I should suspect a cardiovascular disease. For that, there are separate tests.
Okay.
If I want to send my diabetic patient to Dr. Anupama, I should have certain parameters to see
Okay.
and ask her to look at the patient whether kidney is damaged or affected or not. So that means to say, checking simple blood sugar is not the matter.
Okay.
You have to see the patient's all the parameters, more so in the CaReMe diseases, cardiovascular and renal. After checking this, then I can say whether this patient is suffering from CaReMe diseases or not.
Okay. So, Dr. Ratnakar, thank you so much for your insights. I have a question for you from a layman's perspective. Now, a patient comes to you saying that he does not have great metabolism or he is suffering from diabetes. And as an expert, I'm sure you'll be able to analyze his condition. But how do a layman realize themselves that he or she might or might not be going through CaReMe situation?
Very good. For that, patient has to realize or make sure whether he or she has got diabetes or no diabetes. For that, there are protocol-based tests which every Indian earlier used to say 40 years. Now, because diabetes is becoming more rampant, we request to start the screening test at the age of 25. So, if you check into these parameters, to exclude metabolic disorders like diabetes, it should start from screening test.
Screening test, okay.
If patient walks in for a particular problem, we will do. That is not a problem. But if patient has no problem, still if he wants to make very sure that he has no metabolic disturbance, he has to undergo certain screening tests.
Okay.
So I recommend, even though the literature says around 40 years it's enough, in Indian scenario, I advise it should start from 25 years.
Okay.
More so if the candidate's parents are diabetic or the first degree relative, blood relative, is a diabetic.
Okay, okay, noted. Thank you so much, Dr. Ratnakar, for helping us listeners understand on how they can become more self-aware about themselves. We keep hearing that heart diseases, kidney problems and diabetes are a rising issue in the country. How big of a problem is this really? With a country, with a population, with the largest number in the world. So, Dr. Narendra, can you please help us understand how is this going to burden the country or how is this already burdening the country?
Yeah, as I told you in the beginning of our discussion, so we are having a huge population. At the same time, we are having a huge magnitude of heart diseases, then kidney problems, then strokes, then metabolic syndromes, particularly with the diabetes mellitus, which will be affecting most of the other organs in the body. So we call diabetes as a cardiovascular disease. So a patient with diabetes can definitely receive a statin or a blood thinner as of today, right now. So that is the magnitude of the problem. As I told you in the beginning about, younger generation, the second or third decade are also suffering from majority of these problems of obesity, hypertension, diabetes and other things.
Yes.
So as a result, younger population is huge. So this is going to add on to the problems and that can probably really affect the economic status of our country also. Because the person is at, we will be having loss of lives, then of course loss of quality of life. So all these things will add and that will really make a sick country of ours.
Yes, that is absolutely true, sir.
Yeah.
Because overall, what we all want to ensure is that a healthy nation.
Yeah.
And with this increasing thing, it's definitely going to add on to a declining population, or let us say a more unhealthy population of the country.
Yeah.
So, Dr. Anupama, so we just heard from Dr. Narendra on how this adds burden on the entire country. How do you see this reflected in your clinical practice as a kidney expert?
Yeah, we do see a lot of patients coming with kidney diseases. In fact, the numbers are just increasing every year and it is becoming a really big problem. previously we used to see a lot of older patients getting kidney diseases. Now it is not so. Even younger patients come with a lot of kidney diseases, with many people coming in the final stages of kidney diseases. So it is already as much as 1 in 10 persons. If you see, if you are just taking randomly people on the street, at least 1 in 10 will have kidney diseases. And
1 in 10.
yeah, it is a very big problem. And as I told, it goes through 5 stages.
Yes.
So the initial stages, 1, 2, 3 stages are relatively very, very asymptomatic.
Negligible.
So people absolutely do not. It is very difficult to see some patients coming in the final stages, the 5th stage of their chronic kidney diseases. Absolutely no idea. They keep thinking that they'll be having symptoms. They please check. They ask us to check again. Do we have kidney problems? It is a very, very difficult situation for us. And also, when we see young patients who are coming, sometimes, and many people think that it is disease of the old. It is not so. Even sometimes in the 2nd decade, 3rd decade, people can come who are in the college students
20s
or
and
just
30s.
started their earning. Those people also can come with the severe kidney disease. So that is a very sad state of affairs.
Absolutely, ma'am. Because when you see such people, especially who are in their 2nd or 3rd decade, let's say or else 20s and 30s, coming up with big kidney problems, as a doctor, I'm sure it's very disheartening to see that there's a lot of population going through this. But at the end of the day, it's not only just about kidney, it's overall also we see a lot of young population who are getting affected with a lot of things. I'm sure Narendra sir has experienced a lot of young patients getting a lot of heart related conditions, and you as a kidney expert, a lot of kidney problems. And Ratnakar sir was just mentioning earlier on how the screening is not recommended just at 40 but also at the age of 25. So Dr. Ratnakar, I have a question for you out here. You were just mentioning about starting screening for people as young as 25 and being a metabolism and a diabetes expert. So what is your take on the population of the younger generation who are getting prone to diabetes? Because we hear a lot of people nowadays who are hardly in their late teens or early 20s who have diabetes, especially type 2. So what is your take on this?
Yes, madam. This is a very crucial question in the total our show today. I beg all the parents as well as the children should listen to this and see to my talk. For the simple reason, as Dr. Narendra told, India has got 8 to 10 crores diabetic, and unfortunately we have 13 to 14 crores of pre-diabetes. That means most of them will be converted into diabetics in due course of time. The worst part is the total tag which we are talking now, young diabetics. What do you mean by young diabetic? Developing diabetes between the age of 20 to 30, the age where life formation starts, education, family, work, making their dream big. So at that time or the age, if diabetes strikes, imagine the metabolic burden to the total body, and the specialists like Dr. Narendra and Dr. Anupama has to take care of those patients, cardiac as well as kidney issues. Now one statistic says the prevalence of diabetes in India between 20 to 30 years of age is almost 17%.
17%?
Yes.
That's quite a number.
Exactly. Then from 25, below the age of 25, it is almost 9%. Below the age of 20, it is almost 1.4% prevalence. Now we are seeing the very bad shift from elderly populations to younger population. The big question mark is why?
Yes, absolutely.
We had 1 year of very bad time post-COVID where 20 to 30 age group got 77% increase of diabetes in 1 year post-COVID. Now it's okay, now COVID has gone, same 77% rise is not seen now, but my worry is the tendency if continues, the India will be the worst economically hit country in the whole world because the fruitful years are lost because of this disease. Now what is the reason then? Very simple. We are increasing our obesity population from the school kids till the last day of our life. increased incidence of obesity. Our lifestyles are becoming very sedentary. We have become very lazy people, and we are having the worst thing is hereditary. So only these three things? No, there are beyond this. Our food habits in younger generations have become high glycemic, junk food, which contain only calories, no nutrition. Then we sleep late. The quality of sleep is gone nowadays with younger people. The rule is we should sleep 8 hours per day, but not even 6 hours. It is in the kids and school going or college going or working people. So what is the reason? Social media. We keep on searching in the social media till midnight and get up maybe early because of the work pressure. Then we eat bad food and junk food. Overall, all to this, as I told, sedentary lifestyle. We don't burn what we eat. We say we are eating less, but that also we are not burning. The last part is the present generation is behind drugs. The cocaine, heroin, marijuana and IV drugs. And added to this, tobacco in all the forms, from gutka to smoking and chewable tobacco, plus alcohol. Because of these things, I am very sure body metabolism is so much disturbed. Indian young population is towards developing a huge pandemic of young diabetes in the whole world.
Okay. So, Dr. Ratnakar, you just mentioned because of sedentary lifestyle, or probably because of our different habits. It could be the food habits or the sleeping habits, or how they burn their calories. All of these lead to low metabolics in the country, or let's say bigger diabetic capital of the world, let's say. But at the same time, I also have a query out here. How does one reverse this if somebody has such a habit? Is this reversible, the lifestyle?
The beautiful part is the cursed population between 20 and 30, if they decide, they can reverse the whole thing.
Wow, that's
For example,
beautiful.
a school PUC going or a degree going student is supposed to be 65 kgs, he is 80 kgs. If he reduces 15 kgs, all his metabolism will be get reversed. This is what we are calling about reversal of diabetes.
Right.
It is possible only these situations where there is increased body weight, there is very much sedentary lifestyle, there is lot of social stress, economical stress and personal stress.
Yes.
We are all now target oriented human beings. The more so the younger population.
Right.
So more the target, the lesser the quality of life, and worst quality of food and no exercising. So if they correct all these things, take care of weight, do good exercise, sleep well for 8 hours, take care of all of your bad habits to reverse. The whole metabolism can reverse and they can postpone their diabetes for decades together.
Wow, that's beautiful. That's the beauty of it, I believe. So thank you so much, Dr. Ratnakar, for giving us this insights. So you were just mentioning that, people cultivate certain habits. It could be a lifestyle. But all of this don't show an effect immediately. It is something that is very much hidden under the need. But slowly it shows up later. And once for all, it shows up in such a way that it could not be irreversible. But I would like to ask Dr. Narendra a question out here. So Dr. Narendra, as a heart expert, as a cardiovascular expert out here, could you please help us understand how one can know if they have any heart-related conditions and how one can cure this?
Yeah. So you mean to say I want to give you the symptomatology,
Yes,
what all the symptoms that can come
absolutely.
with the
So
cardiac
that
problem.
the small minor
Yeah.
symptoms which people might not realize
Yeah,
it,
yeah.
but when they have something severe, that is when they know that, okay, there is a big pain or a major pain out there, or they might be facing various other issues.
Yeah, yeah.
But until and unless it goes to that serious stage, it is always better to cure in the beginning stages than in the later stages, is I'm sure what you believe as well.
Yeah.
So would you tell our listeners on what is the best way that they can identify this?
So I will be doing some mimicry also in between while actually showing the symptoms.
Sure.
So as you all know, cardiovascular symptoms, the most important symptom, of course, which actually will be dreaded for any individual when he suffers from it, is the so-called chest pain. So chest pain is the most important symptom of cardiovascular problems, particularly heart attacks, what we say. Then we have, of course, breathlessness is another important symptom. Then, of course, easy fatigability during exertion, having chest discomfort and other things. Then of course, sudden episode of vomitings associated with chest pain.
Okay.
Then of course, loss of consciousness. Then rhythm problems, palpitations, slow heart rates or fast heart rates. So these are several of the symptoms that can be there associated with different types of cardiovascular problems.
Okay.
So not all heart diseases are heart attacks, that you
Yes,
should always
absolutely.
remember. So
Absolutely.
there are heart diseases which are there since birth. They are called congenital heart diseases. They are actually holes or unwanted vessels in the circulation which can be cured actually. So they are all totally different. And what we are bothered about, what we are worried about is the so-called heart attacks actually. It's called myocardial infarction, that is what we say. So remember, 1 out of 10 presenting to the emergency room, the so-called casualty, is likely to have a chest pain of cardiac origin. So it is either almost an easy loosening thing or is an actually some symptomatic thing. So means only 10% of people who present to the emergency room will be diagnosed to have heart attacks. The remaining 90%, they are there with worried to see that probably they are having heart attacks or not. So they are likely to be non-cardiac in origin. So there are so many. I will just mention about the non-cardiac conditions. For example, when an acute gastritis, some food disturbances, excess alcohol, or some painkillers that have taken, they also will produce similar type of chest burning sensation in the middle of the chest, which they may confuse, probably it is cardiac, and they may present to the emergency room. Then muscle pains, joints pains, all these things also can actually present with the episode of chest pain actually. But the typical features of chest pain of cardiac origin. So usually way back in 17th century, one person actually, Levine is the person who actually described this particular thing. So they actually pointed with a closed fist kept over the chest like this.
Okay.
So it is not a localized pain. If somebody says he is having a pain like this, which comes on and goes in seconds, it is unlikely to be cardiac in origin.
Okay.
So a heart attack chest pain will last for at least 5, 10, 20 minutes.
Okay, that's
So
very
just
long.
a second's pain is not related to heart generally, in general.
Okay.
And it is not a pricking or a localized type of chest pain. It is a blunt chest pain, dull aching chest pain, compressing chest pain. People say as if two pilewans are actually holding a strip around my chest and pulling in opposite directions. Some people say as if the front wheels of a lorry are landed on my chest. So called a compressing type of chest pain.
Got it.
Some people show like this, or hinguri barutte. The way they show like this. So it's like a burning sensation like this. If they show towards the neck, is most of the times it is likely to be cardiac in origin. So a burning type, a compressing type, or a constricting type, they are usually the usual descriptions of the chest pain of cardiac origin. That is what we say. So lasting for more than 5, 10, 20 minutes. And associated features, most of the times they are associated with sometimes loose motions, sometimes vomiting, nausea sensation, excessive sweating. And this chest pain, it can radiate actually. It need not stay there only. It may go back. It may go up to the mandible, lower jaw, that is our boundary, and it can go deep down up to the umbilicus. So below umbilicus is usually not the domain of the cardiovascular system, and above jaw is not the domain of the cardiovascular system. These are the usual things, and this can also radiate to the arms, shoulders, some numbness in the sense, some sense of weakness, and all these problems will be there. So if these things are there, when associated chest pain is there along with these symptoms, probably you are dealing with a cardiac. So means the patients themselves have to think, probably I am having probably a manifestation of cardiac. And anywhere in this part of the country, within a kilometer or 2 kilometers, you have an ECG facility, the most important thing. You cannot take any first aid at your thing for your chest pain. You have to get it ruled out, probably it is cardiac or not, with the help of a simple ECG. And most of the times, even in suburban areas, we have so-called troponin I levels. That's one of the biomarkers. It probably, if you have a confusion, ECG is normal, but you want to rule out, it can be ruled out by the help of so-called cardiac biomarkers. That is one of the enzymes which will be released in case of thousands if you are having a chest pain of cardiac origin. These are the two things which I advise can be almost recognizable and achievable at any point of country, point of place in our country actually. Then breathlessness and all, when there is a complicated heart attack, then they'll have breathlessness, they'll have wheezing type of things, frothing in the mouth, all these usually they suggest that there is a complication of the heart attacks. So the most important symptom is chest pain. If it is localized, comes on within seconds and goes. So, or it is brought on by coughing or deep inspiration, they are all probably not from the heart. Whereas if centrally located chest pain, widespread chest pain, compressing in nature, constricting nature, burning with radiation, probably it is cardiac in heart. And already if the patient is a diabetic, elderly, women and having hypertension and other things, they are likely to have more chances of a cardiac origin chest pain. So in that background, they should actually be stimulated. And of course, not all people with heart attacks can get symptoms also. There are many people who can have so-called silent heart attacks actually. Particularly diabetic individuals, they can have silent heart attacks. They present to the emergency room with loss of consciousness, unexplained sweating or easy fatigability. Sir, ಇವತ್ತು ಯಾಕೋ ನಂಗೆ ಆಗ್ತಾ ಇಲ್ಲ, ಯಾಕೋ ಸುಮ್ಮನೆ ಸುಸ್ತಾಗ್ತಿದೆ, ಏನು ರೀಸನ್, ಶುಗರ್ಸ್ ನಾರ್ಮಲ್ ಬಟ್ ನಂಗೆ ಯಾಕೋ ಆಗ್ತಿಲ್ಲ. ಸೊ ದೀಸ್ ಆರ್ ಸಮ್ ಆಫ್ ದಿ ಡಿಸ್ಕ್ರಿಪ್ಷನ್ಸ್ ದಟ್ ಆರ್ ಗಿವನ್ ಬೈ silent heart attack. So silent heart attacks is something unexplained. Every day we will be doing some job, so either sweeping the floors or climbing stairs and other things. This day you are unable to do it, so there is something problem, there is something wrong with you, so you have to get it investigated. Illa sir adu hengo bantu aag hogtu andre, so that will definitely you will be actually risking your life at all. So something happens which is unusual for that particular activity which you were doing earlier without any hindrance, so that is where you have to get it actually checked. So silent heart attacks can occur, but most of the time can also occur. They can present with acute gastritis. Many times gastric ಆಯ್ತು ಸರ್ ಅಂತ ಬಂದಿರ್ತಾರೆ, we record ECG and that shows a real sudden episode of heart attack actually. So silent can be there, particularly in diabetic individuals, silent symptoms, in elderly people, in hypertensives as well as women. So they are having so-called unusual features of cardiac presentation. So these are usually symptomatologies. So if you have something which is unusual for you, if you are already a risk factor for a cardiac problem like an hypertensive, diabetic or aged person, you have to get it evaluated, ruled out, the nearest possible hospital or clinic with only just two things. Get an ECG, get a blood pressure checked up, get your blood sugars and a troponin high. That probably will clink the diagnosis. Stay there for at least 2-3 hours. So they will have serial ECGs. Your present ECG, first ECG may not show changes, but subsequent ECGs may show changes. So stay there, be calm, and then try to get it evaluated, and then actually you can actually decide what to do.
Wow. Thank you so much, Dr. Narendra, for giving us such insight and very big informative value on this, because not every person might be aware on how to detect this. You just mentioned it could be the complications ones where people are having difficult to breathe, or probably nauseousness or the vomiting or the loose motion. So these are some early signs on which you just mentioned. And if a person is having a heart attack, probably a compressed feeling, or like you just mentioned about two pahalwans fighting each other. So these are easy symptoms which people can identify because they can feel it. But I always wondered, how does a person who has a kidney issue always know that they are facing something? Because when it comes to heart, you just mentioned a lot of symptoms. But when a person is having kidney issues, or let's say something serious with their kidneys, not a lot of people realize that they are going through something serious. So ma'am, can you please help us understand on how our listeners and let's say the audience, the patients out there can understand that yes, they need medical help immediately?
Now, people with kidney diseases generally do not understand that they have very, very vague symptoms. Many of the times they are asymptomatic, as I already told, but sometimes even very, very vague symptoms that they may just have a loss of appetite. They may be just not able to eat. Previously, they used to eat well. For last 1 or 2 months, they're not eating well. Or they may just have some unexplained weight loss.
Okay.
Or they may just have some difficulty in doing regular activities.
So just like
just
how
generalized weakness, that's all.
Okay.
Some anemia, sometimes they just have some anemia, some blood decreased hemoglobin.
Okay.
And they have difficulty in doing their regular activities.
Okay.
So this also can be a very, very subtle symptom of kidney disease.
Okay.
In later stages, kidney patients can have swelling of the feet,
Okay.
or facial puffiness, or they can have some difficulty in passing urine, or they can have some increased quantity of urine output at night, which is a very typical symptom of kidney disease. They can have normal urine flow during the day, but at night they get up multiple times during the disturbing sleep. So that is also a part of kidney problem, because the kidneys do not have the concentrating ability.
Absolutely.
Yeah. Then they can also have decreased urine output. In later stages, further later stages, they can have decreased urine output. That many often these symptoms are so slowly progressing that they may not even recognize.
Pay attention to that.
They do not pay attention to that. Sometimes they say, no, I am passing normal quantity of urine. But when you ask them to actually measure, then there will be some just less than 500 ml per day or something like that. So then in normal cases, they have to pass at least 2 liters of urine per day. They may be as low as 500 ml per day. They would not even have noticed that. So it can be that very slow progression. And one very important sign I would like to bring up here is that people with kidney disease have hypertension most of the time, 90% of the times. So if you're having a BP picked up, especially when you're young, if you're going to the doctor's clinic and if you're maybe 30 years, 40 years, and even 20 years, BP is picked up, then that could be a very important sign of kidney disease. So you have to get evaluated for the kidney disease. And another important thing is that there is no age limit for kidney disease. So multiple times you have young people, even less than 10 years, 20 years. They can also have kids. They can also have kidney disease. So, I mean, it's relatively rare, kids having
but
kidney
it is
disease,
possible.
but it's still possible.
So
this is something which should be borne in mind, because otherwise people are not
Absolutely.
noticing it.
Absolutely.
They don't see the failure to thrive. Means kids may not grow as much as they
are supposed to
generally
grow.
do.
Yes.
Yeah. So their height may be lower, their weight may be lower, they are not very playful. All these are minor symptoms, mild symptoms, things which can be easily missed. So those are also part of kidney failure. So all these constellation of symptoms are, you must be, I mean, people have to keep an eye on that so that they do not miss the kidney disease. But in spite of that, it is very, very common to miss the symptoms.
Yes, ma'am, absolutely. Because a lot of people are aware on what cardiovascular issues could be, because it is faced by a lot of people out there in the country. But when you speak about kidney problems, some people even wonder if kidney can even have a problem. They might be having a problem, but they do not realize it.
And denial is a very important.
Yes, absolutely.
Even if you say that you have a kidney problem, very often they say, how can I have kidney problem? I have normal urine output. I have this. Nobody in the family has kidney problem. So these are all very common symptoms. Denial is a very important problem with kidney diseases. And how do you test all this? This is also important. I touch upon here itself. Very, very simple tests. Then you don't have to go for very high-tech tests in case of kidney disease. Just 2 common tests. One is the serum creatinine level.
Serum creatinine level. Okay.
And another is a simple urine test. Both these tests are very, very widely available in all the laboratories. You don't have to go to a multi-speciality hospital or a corporate hospital or any major hospital only for this. Any laboratory will have this test. So if you see any like the creatinine is supposed to be about 1.2 milligram per deciliter. If it is a little beyond that, then you have to consult a kidney specialist. And the urine analysis as well. If there is proteins in the urine, very often we see people test urine for just sugar, especially diabetics. They go for the urine sugar. But it is very important to check the urine protein as well. At least you do this once a year. If you're a diabetic, you do this at least once a year. And then if there is proteinuria, you have to come to the come to the nephrologist, kidney specialist, or at least you consult your physician for further evaluation. And these are 2 important tests, and sometimes there can be color changes also. So maybe some blood in the urine. This should not be neglected. So these are some of the very common tests. And if you find any abnormality with these tests, one further test that we can ask for is the kidney scanning, the ultrasound abdomen. So these 3 are enough for us to at least
so the urine, it's a scanning and serum creatinine level test.
Very, very simple test, available everywhere. And people should not miss, at least, especially if they are diabetics or if they are hypertensive, if they have blood pressure, whether they are out of control or in control, they have to get this test at least once a year.
So thank you so much, Dr. Anupama, for giving us an insight on this. But ma'am, we know that diabetes, like you just mentioned earlier, and cardiovascular diseases, they can be hereditary. What about kidney problems? Are they hereditary as well?
Yeah, there are some diseases which run in the families. But there are some diseases which are related to metabolic problems as well. So the conditions like polycystic kidneys, they have, some patients have this bilateral, both kidneys are enlarged and they have a lot of water filled cysts, water uh, bubbles, something like that on the surface. Studded, the whole kidneys are studded with the cysts. So this is called a polycystic kidney disease. This is a very common condition which can run in the families. Other than that, also there are multiple other conditions which can run in the families, and especially younger children can also have when they have kidney disease. Most of the time, either it is related to some congenital problems in the urinary tract, where they have difficulty in passing the urine. The urethra may be narrowed, so these are the urine duct through which you pass the urine outside. So that may be blocked, or there can be a narrowing. That may be there, or it can be some condition called a reflux, where you do not pass the urine outside. When you are trying to pass the urine, some of the urine goes out, but some of the urine comes back to the kidney. So that causes a lot of pressure on the kidney, and that is another important cause, especially in the children.
Okay. Thank you so much, Dr. Anupama, once again for helping our audience and listeners understand what could be the impact on whether it can be hereditary or not, and especially the symptoms like you just mentioned earlier about passing less urine or the puffiness in the feet, or it could be as simple as not able to do the daily chores. So thank you so much for sharing all these small symptoms, because our listeners might take this into serious note, and of course they're going to implement on their near and dear ones. So we just heard Dr. Narendra, who just gave us an detailed insight about those symptoms of heart or cardiovascular issues, and we heard Dr. Anupama, who just gave us the symptoms of the kidney issues. But we all know that diabetes is a major problem in the country. India is the largest capital in the world who has diabetic patients. But sir, I have a doubt and a question here. So when a person is having diabetes, of course they get to know at a very later stage. How to avoid it in the very beginning stage? How does one even realize that they are prone to diabetes?
Very interesting. When both of my colleagues say that heart attack can be silent, kidney failure can be silent, I can also say that diabetes also is silent. For example, in 1980s, when I was doing my post-graduation, usually son or daughter used to bring 60, 70-year-old parent, whether mother or father, to the hospital to evaluate for the symptoms concerned with diabetes. Now it is reversing. Parents are bringing children. As I told you, it is more diagnosed in younger people. They are called as young diabetics. Now your question is whether diabetes also can be silent. Yes, most of the times all of our experience say that they come for something else. So we detect the diabetes. The one statistics is so interesting. 33% of the individuals who walk into the endocrinologist clinic or so-called diabetologist clinic, they are all diabetics.
Oh.
The worst part is 50% of the diabetics diagnosed, they don't know that they are diabetics. We only tell them after testing that you are diabetic. This goes to 50% of the total detected diabetes.
That is a huge number.
Very huge. Here lies the trouble. Because it is silent, nobody wants to go to a doctor. But as you asked, there are some subtle clues or a major clues which we have to take it very seriously. Number one, unexplained weight loss. If a techie, the software engineer, walks into my clinic, he says that last year he was 100 kgs, today he is 90 kgs. Sir, I have not done anything, neither the dieting nor the exercise, but I have lost 10 kgs. It is an open diagnosis of diabetes for me.
Okay.
I will openly tell him and send for tests. The unintentional, unexplained weight loss, increased hunger, that is polyphagia, increased thirst, that is polydipsia, or increased urination, that is polyuria. Apart from this, there can be other things which really gives the person or the patient a shock, a non-healing wound, burning of the feet,
absolutely,
and repeated infection of the genital area. These are all the small clues which makes us to suspect diabetes. then we ask for the test. So majority of us see it as a silent disease because patient is unaware, but by the time we diagnose, there can be even worse things. For example, in casualty, Narendra will get a call for a heart attack patient. When the sister does the blood sugar, it can show as high as 400. If you ask the patient or the relative, no symptoms. No sir, we don't have sugar. Same thing, a patient has come for some other problem. We check for creatinine. If it is above 2, 3, we say it is almost like end stage renal disease with our experience. But we send it to Dr. Anupama for the better evaluation. So much of silence is there in this metabolic disorder. That is why I even now insist the screening is a must for preventive metabolic diseases or prevention of the metabolic diseases. So there can be signs, symptoms of diabetes, or there may not be a single clue, but as doctors, it is our rule to check at least after the age of 30, but I insist from the age of 25 years.
Yes.
With or without symptoms.
Okay. So thank you so much, Dr. Ratnakar, for throwing some light on this topic. So you just mentioned on, people might either have a sudden weight loss, like the software techie example you just mentioned, or various other symptoms. It could be sudden weight loss or
increased urine.
Yes, absolutely.
Increased hunger,
increased urine, and some tiredness. So all of these are symptoms of diabetes. So if a person comes in the very early on stages, is there a possibility, is there a hope that this person's issue, or let's say the diagnosis, can be reversed?
This is the hot topic of all social media now. I get in at least 1 or 2 patients per week, consulted all the doctors, but somewhere they see in the social media that diabetes can be cured. Even now, every day we said that claim. The first thing which I say is, I am not going to cure any of your problems, but I will suggest, after going through all your investigations, whether it can be reversed.
Yes, absolutely.
Cure is entirely different from reverse.
Absolutely.
Or at least remission, which is possible only after going through all the literature. For example, if he lies that today it is detected, other parameters will give me the possibilities of long-standing disease. For example, if he already has got an heart attack, I will not accept his denial.
Absolutely.
If person's creatinine is above 1.2, whether irrespective of the age, I will not accept it as a fresh disease. So if it is really fresh, as I told earlier, if there is very unhealthy sedentary lifestyle, overweight, overeating, not sleeping well, recently detected diabetes, all these factors can be corrected. I will assure the person can be considered for remission or reversal of the diabetes.
Awesome. Thank you so much, Dr. Ratnakar, for giving us a detailed insight on if or if not a situation can be reversed or not. Because of this, a person's lifestyle can be changed, their habits can be changed, and of course, the person can go into a better path, ensuring that they lead a healthier lifestyle.
True.
So, ladies and gentlemen, all the audience, as you all know, we have been only talking about a lot of problems. But now, let's come to the solutions part. As you all know, the CaReMe diseases, or let's say this entire group of cardiovascular, renal and metabolic diseases, we have all discussed about. But let's all hear the solution for the same. So, Dr. Narendra, we have been discussing a lot on all of this. So, how do you think a treatment plan is supposed to be designed for a patient who has CaReMe diseases?
Okay. So at the outset, I would like to mention that way back in the 1930s, 1940s, the average life expectancy of an Indian was around 35, 36, 37 years. That's all. Very few people used to live for 90 years, 80 years and other things. Large majority used to die because of infectious diseases.
Okay.
So over the years, with the advancement of technology, with the advancement of sciences, in all fields of medicine, starting from cardiovascular to diabetic, everything, we have started actually achieving greater and greater life expectancies now. So as of now, as we stand today, The average life expectancy of an Indian is around 68, 69, up to 30, 70 years we have actually come.
That's
So
beautiful.
almost 20, 30 years we have added on to our lives actually. But at the same time, as we age from 60 to 70 to 80, we keep actually inviting troubles with respect to strokes, with respect to heart attacks, kidney failures, everything. So we have to have a comprehensive role, comprehensive lookup with these particular problems actually. So way back in 1960s, as the only treatments were available for heart attacks was just a rest in a dark room for about 4 to 6 or 8 weeks. So people used to die of pulmonary embolism, deep vein thrombosis because of lack of activity. Although there was chance of surviving from heart attack, they used to be killed by the sedentary part of it, which used to kill them, pulmonary embolism. So then actually subsequently in cardiovascular disorders, then came back so-called sitting arm treatments. So they started actually put them in the chairs, mobilize them to some extent, and so that was the only treatment that was available. From 50s, 60s, 70s, this time, so we had bypass surgeries.
Yes.
Subsequently, you have lot amount of armamentarium with respect to antiplatelet drugs, statins, so-called cholesterol lowering drugs. Then we have blood thinners. Then we have anticoagulants, so on and so forth. And of course, right now we have available primary angioplasties, wherein within 30 minutes or 60 minutes or 90 minutes of an heart attack, the patient can be wheeled to a cath lab in most of the major cities or even suburban cities in this country, and a stent will be actually delivered to him, and he will be cured of this particular cardiac problem. So we have actually gone down from the era of infectious diseases to so-called actually non-communicable diseases in the form of diabetes mellitus, metabolic problem and other things. So we have a lot to actually offer to these patients. But the best thing would be, so as we always say, prevention is better than cure. So instead of getting into these treatment aspects, first we should know what to prevent these heart attacks and other things. So for this, we have a very simple formula wherein we say, know your numbers and believe your numbers and treat your numbers. These are the three things that are there. So the numbers are very simple. It is actually so-called, they are all modifiable, and it is possible and reachable by every individual of this country. The first thing would be your body mass, that your body weight. So body weight is always related to your height. So any Android phone, you just get into body mass index, you will get easily your body mass index. For that, you should know your weight in kgs, you should know your height in meters. Very simple. So body mass index, so-called BMI, less than 18.5 is underweight. So you have to put on proteins for your things. So a healthy body mass index would be between 18.5 to 25. That's the usual body mass index. So if you are in that range, your number is okay. So your one number is okay. If it has crossed 25 up to 30, we call it as overweight. Of course, in Indian population, we keep 26 itself as obesity. Whereas in the Western population, because of their height and other things, they actually consider above 30 as obesity. But in our country, we have to, so obesity and overweight are almost the continuum of the same problem, the metabolic problem. But our thing is, so both of them should be treated very, very drastically. So your body mass index is very simple, means you have to do something. You have to do lifestyle, healthy lifestyle changes, to do walk, then keep away from processed foods and all those things you have to do. This is the first number you have to consider for prevention. The second number would be your blood pressure, as hypertension is one of the important risk factors for cardiovascular problems. Hypertension. So general blood pressure levels, good numbers would be less than 120 systolic and 80 diastolic. 130/80 or 130/90 is reasonable, but above 140/90, you have to take something else. So you have to stick on to lifestyle changes, do regular walking, avoid salts, all those things you have to do. So the second number would be blood pressure. So your ideal pressure less than 120/80 or at least 130/90, and beyond that you have to actually get into it. And even beyond that, if it is not controllable, probably you have to consult a physician or a cardiologist for the drug management of your this thing. Majority of the times, mild to moderate hypertension, they are curable by your lifestyle changes, the so-called remission. You can actually do it with it. Third thing would be your sugar level. So one is body weight, second one is blood pressure, third one is blood sugars. So we say usually your fasting sugar should be less than 90, your postprandial should be less than 140, 160, And last 3 months average, we call it as HbA1c. That is a very important clue. So one figure may mislead you, but you can get an average blood sugar levels for the last 3 months. HbA1c ideal would be 5.5 and less, and above 6.5 will be dangerous. So you will be diagnosed to have diabetes at that particular point of time. So that is blood sugar. So if the blood sugars are above this particular range, you have to consult. You do start doing lifestyle changes first, as basically, and then have to consult experts for this particular matter. Third, fourth thing would be our cholesterol levels. So cholesterol levels, we say we are having a very, with metabolic problems, with diabetes, mellitus, smoking and added, we need very, very low cholesterols in our country. So we usually get a lipid profile wherein we get total cholesterol levels, HDL levels, LDL levels and triglyceride levels. So out of these, two are very important. One is total cholesterol. We need it below 200 in general population, in adult population, and LDL below 130. And HDL is a good cholesterol. As high as you get, you will be better for you actually. Triglycerides generally are not risk factors for cardiovascular problems, but very high triglycerides can actually produce pancreatic problem and other problems. There also you have to cut it with calorie cuts and other things. We have separate drugs for all these things. So if you have crossed this particular thing, so you have to get a lipid profile. From what age is the question? In Western world, they say at 20 years itself, you have to start getting your lipid profiles done. Once in 5 years, if it is abnormal, once in 2 years like that. At least in our country, with this magnitude of endemic problems, we have to start at 30. There is no actually short going. So at 30, you have to get a lipid profile basic. If it is abnormal, keep a check on your blood cholesterol levels. These are the target levels. Those who have already suffered from heart attack, we have very, very low levels. Our LDL should be less than 55. General population is 130. For those who have already suffered from an heart attack, it should be less than 55. Means very drastic diet. Plus, of course, we have very good drugs to control this particular thing. So that's all about the cholesterol. Then, of course, body mass, we told hypertension, then diabetes, and then, of course, blood sugar levels. Avoidance of tobacco in any form. That's the most important thing. So cancers and heart attacks and strokes, they are always friendly with tobacco. So if you want to invite any one of them, stick on to tobacco. If you want to keep you away from them, try to keep it away. So tobacco in any form, in any this thing should be avoided for that matter. Then of course, the fifth risk factor would be stress. So this stress was not there in olden times. There used to be a family, big family. The head of the family used to have stress. The remaining members of the family never used to have stress because they had their own designated jobs. Right now, each individual, the son or daughter or father, they have their own stresses of different levels. Competition to achieve greater things in very short period of time and all these things, stress, then lack of employment, then not good salaries, all of them will add, plus cost of therapy. So once you have disease, you have to spend, don't have money, you get stress. So this is a vicious cycle. So stress management should be individualized. So we have stress for different problems. We have our own mental setups for which we become stress. For something which one is stressful for an individual may not be stressful for another individual. Absolutely. So we have our own actually weaknesses or things, but you have to manage your own stress. There is no short going. Good sleep, yoga, meditation, listening to music, playing, all those things will add to a very good type of stress management. That's individualized. You may take help of individuals. There are psychosocial aspects. Then of course, dietitians are there, nutritionists are there, and all other people are there. And now, of late, in some cities, they have actually some pilot studies are done wherein this environmental pollution is added as another stressful factor, another risk factor for cardiovascular and other problems actually. So you have to take care of this. I don't know how to take care of this in mega cities and all, but it is an added on risk factor along with these 5 as I told. So know your numbers. If you know your numbers, definitely you can lead a very good point of life. Once you have tried to prevent, without your knowledge, you have got into a cardiac problem. So it is your duty that you should have a regular checkup of your distinct problems. Prevent, postpone complications. So to get on to your regular exercise habits, keep away from tobacco, keep on getting the tablets that are being actually prescribed by qualified persons, regular checkups and all. checking other things, the CaReMe diseases.
Yes.
So a cardiac patient can have a renal problem, or a drug that is being advised for cardiac problem may have some renal side effects. So all drugs are not safe. So they have their own problem, they have other effects, they have their own side effects also. So you have to keep checking for metabolic problems, for renal problems when patient is already on. So as I told you, they are all interconnected
Yes.
with nerves and blood vessels. You cannot actually go out of them. So this is how those with respect to preventive aspect, those with respect to protection after you have suffered from a cardiac problem. So likewise, so by all these, you can have a holistic approach of controlling your body, your organ systems, and see that you will live long, and at the same time your quality of life is also better. You can earn for a good number of years.
Absolutely.
For yourself as well as your family.
Family.
So that is what is my message.
Wow.
Okay, right.
That was very deep and very insightful. Thank you so much, Dr. Narendra, for throwing us a very big light on this topic, because when I asked about how one can prevent, or let's say protect themselves from CaReMe diseases, you told multiple ones. It could be in terms of population, so the pollution, or it could be in terms of the stress levels, or it could be in terms of BMI. So keeping a track of all of these is going to be a really hard challenge for an individual. So let us say an individual who is a young adult who wants to ensure that he or she leads a healthy lifestyle. So how often should one get tested to ensure that yes, they are on the right track of health?
Yeah. So as I told you earlier, Western world, it is 20 years. Now, of course, in India, we
So
have
how
started
many years
30.
once, or how many
Yeah,
months once?
After you start 30, at 30, first you have a baseline of all these risk factors. As I
Yes.
told, blood pressure, very simple,
Absolutely,
can be
yes.
recorded anywhere. Blood sugars, blood cholesterol levels, and of course, keeping away from all those things are there.
Yes, yes,
Once they are abnormal, so then probably your lifestyle, extra lifestyle changes. Generally, we should live with lifestyle changes only, always, forever. It's not that when you get the disease, you start walking.
Absolutely.
No, that is never the situation.
Prevention is always better than cure.
Earlier, actually, we were playing for hours together. So that actually kept us away.
Yes.
We were never at mobiles. We were never at TVs. So we had a lot of time to enjoy ourselves, keep our stress levels low. Now, of course, unfortunately, there was not so much of competition in those years actually. So once at 30 years, third decade, baseline levels are done. So if your body was, as I told you, all those things, if they are within range, once in 2 years or once in 3 years, you can get
Is
it
it
done.
recommended?
Recommended.
Okay.
In case something is abnormal, you can actually pinpoint that particular aspect and keep on
And address the issue.
every year or once in 2 years, depending
Sure.
upon the physicians, this thing. And based on your development also. Most of the figures you can have with the laboratory figures.
Absolutely,
You can
yes.
check whether it has gone beyond range. They will give ranges also. Everything is actually tailor-made. Everything is user-friendly.
Yes. Thank you, Dr. Narendra, for telling us on how often one can get tested irrespective of whether everything is normal or not. And along with that, you gave us a lot of insight on how one can be healthy and ensure that they have a good cardiovascular system in their body to ensure that they do not have any heart-prone diseases. So you gave us all of these insights and information. But I also wonder on how one can protect their kidneys. And I request Dr. Anupama to kindly throw some light on this, because Dr. Narendra just explained us various facts on how one can protect themselves from any cardiovascular issues. So if a young adult, or let's say not only young adult, if a child or if a person who is in their mid-50s or a senior citizen wants to protect their kidneys, what is the best way that they can protect and ensure they have healthy kidneys until their last day?
So the essentials, lifestyle changes or lifestyle problems, what this CaReMe syndrome, this is a part of CaReMe syndrome. So
Yes.
it's the same, almost similar grounds. We have to check the body mass index. We have to check another thing is abdominal obesity is also very important risk factor. So some people are not actually obese, but they can have fat in their bellies.
Okay.
So stomach fat is also very, very bad.
Just the trunk fat.
Yeah. So that should be kept in check. And also keeping the blood sugar and blood pressure under control. These are the fundamental rules for any CaReMe syndrome. In addition, people have to, even in the young age groups or even mid-age, the adults, if they have to prevent kidney diseases, they have to have essentially a low salt diet. They have to prevent hypertension.
Low salt diet
Yeah.
and hypertension. Okay.
Not go for junk food, not
Okay.
go for high salt diet, because
Okay.
nowadays the the food that we get generally in all outlets is generally high salt food.
Okay.
So this is to be avoided. The carbonated drinks, that has to be
Yes.
avoided, because that is nothing but sugar and water.
Absolutely.
And a lot of phosphorus also will be there, so that is all bad. So that carbonated foods and salty foods, high salt food, then high fat diet, all that has to be avoided. This is in terms of the general good health,
Yes.
to prevent not
Kidney
just kidney
issues.
disease,
Overall health.
overall health.
Okay.
They have to, for the kidney disease in particular, they have to take at least 8 to 10 glasses of water every day. And the other important aspect is the passing urine, that where you have to pass urine at regular intervals. Many people have this habit of holding the
Bladder.
urine till quite some time, or till maybe 6-7 hours. Children especially, they have this habit of holding the urine. They will not go to the washrooms frequently, every 3 hours, 4 hours. This has to be taught in early childhood. The bladder training has to be taught, and even women, when they are traveling, they try to hold
Yes.
this one. This should be avoided. So these are some of the common sense precautions that people have to take to avoid kidney diseases. Once they have some metabolic condition like diabetes or hypertension or obesity, then they have to be extra cautious, and at least once a year they have to get the tests for
Yes,
the
the test which you prescribed earlier.
kidney.
Yes.
At least just basic urine analysis and creatinine test, that has to be done.
Okay. Sure, ma'am. Thank you so much, ma'am, for giving us the insight on how one can prevent kidney diseases. And you were just mentioning about 8 to 10 glasses, or how women, or let's say children, try to hold on to their bladder. But, ma'am, if tell us something out here, but in sometimes situations which is not favorable, let's say a woman is traveling and she does this once in a while, does this also affect sometime in the long run?
No, once in a while, if she holds, it's not going to be a problem. But if repeatedly they are holding, like you have women in workplaces,
Yes.
sometimes they do not have favorable workplaces with the good washroom facilities.
Yes, absolutely.
And then they hold on for long periods,
Yes.
for many years, many months or many years. Then that can be a problem. That can
A
lead to
regular practice of the
weakening
same.
bladder, and then
Yes.
can have repeated urinary infections in later life.
Sure.
So that can be avoided.
So a regular practice of the same will
Once
affect.
in a way, it's not going to harm.
Okay, sure, ma'am. Thank you so much for giving us insights on this, and also giving us more detailed information on how one can ensure that we have healthy kidneys, not just with the water, by also avoiding fatty acids, or let's say, avoiding the high salted foods or carbonated drinks. So thanks, Dr. Anupama, for the same. Now, Dr. Ratnakar, we just heard Dr. Narendra and Dr. Anupama, who just threw some light on how one can prevent cardiovascular diseases, or let's say kidney diseases. Now, as a diabetes and a metabolism expert, what is your advice on how one can control the diabetes to ensure they have healthy heart and healthy kidneys?
Very beautiful part of the total show, because diabetes management is patient oriented, not doctor oriented. I will put it still simpler. The diabetes management needs self care. That means the person who is having diabetes should take care of themselves. Then why the doctor? Doctor is only for guiding the healthy lifestyles, periodic checkup, dietary pattern, and preventing the complications. All these things come to the doctor's purview. For example, my own regular patient overnight develops an heart attack, and I refer to Dr. Narendra. After his management, he will instruct me to change certain drugs.
Yeah.
For example, if that patient is on atenolol for hypertension, post MI or post myocardial infarction or the heart attack, he doesn't like that molecule. We have to change. Here the doctor's role comes. Otherwise, in total, diabetes management is self-care oriented.
Okay.
In the sense, the person who is having the diabetes should manage. What are all the things to manage? It is not an hi-fi science. They have to take care of their diet,
Exercise.
timely food, correct type of nutrition which satisfies carbohydrate, protein, fat, vitamins, minerals, and water, and they have to be really, as you said, exercising. Some kind of exercise, whether it is just walk or a treadmill or a gym or a cycling or a swimming or yoga or pranayam, whatever they like. They have to burn the calories required to avoid, as Dr. Anupama told, there should not be a truncal obesity or abdominal obesity, because that is a marker of insulin resistance, that is a marker of cardiovascular and renal disease. So unless we manage the truncal obesity or the fat covering the abdomen, no treatment will save the patient. Blood sugars may be normal, but still patient develops an heart attack.
Yes.
If you look at their tummy, it itself says diagnostic of cardiovascular disease.
Okay.
Then coming to another situation, my own patient, suddenly I see creatinine 1.4 or more. I ask Dr. Anupama's help. She will definitely send me a note, please change this drug for diabetes. That means every patient needs look and relook for the whole lifetime for the management of the disease, because the patient oriented treatment should overtake from the algorithm or the protocol which ADA or Indian consensus says. That is definitely a pattern to follow, but we have to individualize to a particular patient depending on the scenario. If she says sulfonylurea should not be used, glimepiride should not be used in this case, I have to withdraw it and supplement. For example, SGLT2 inhibitors are fantastic drugs, starting from canagliflozin, dapagliflozin, empagliflozin. Patient is doing well, but he develops one urinary tract infection, two second time urinary tract infection, and third time patient will not come to me, he or she will go to Dr. Anupama, because I have missed the bus.
Yeah.
I should not have used or continued the SGLT2 inhibitor to avoid the urinary tract infection. She rightly points out, comes back, she sends back to me telling that this drug is the culprit for urinary tract infection. Please take off that and substitute with some other drug. Like this, it is situational, individualized, age or comorbid diseases, or what are the end organs patient already has got. So we have to design and redesign the treatment part. The latest GLP-1 agonists, they are making big news in the market now. Can our all Indian patients afford? No, they cannot. For example, most of the GLP-1 agonists are injectables. They have to inject very often, at least weekly once. So everybody cannot afford. It runs to 5,000, 10,000 rupees per dose. And they say it should be taken for a minimum of 2 years.
Oh my.
Either to reduce the weight or for diabetes management. So as I said, in such people who don't have, because in India, most of us we pay. Insurance doesn't pay for outpatient treatment. So then cost factor comes. So we have to look into all these things, individualized, trim to the patient's requirement, and insist every patient, whether it is a villager or a corporate sector king, we have to tell self-care, periodic checkup, home glucose monitoring, maintaining the all the statistics, and whenever doctor calls for checkup, periodically they have come and assess, reassess and treat the patient as a whole to prevent CaReMe disorders or this crisis.
Okay.
So if a clinician, whether he is a physician or a diabetologist, they should see that patient should not end up with end organ damages by wrong treatment.
Yes, absolutely.
This patient also should know, and all the doctors should know, each diabetic patient needs a special look, at least for special situations.
Yes, absolutely. Thank you so much, Dr. Ratnakar. So earlier you were mentioning about, maintaining, the diabetes is a self-care, or let us say a your own doctor is what you were mentioning about. It could be the diet or proper nutrients or proper sleep and proper exercises as well. Until and unless there is no other issue related to heart, cardiovascular, or probably kidneys, renal, let's say. But you were also mentioning that one has to always be active along with proper nutrients and, let's say, exercises and the diet and the nutrition and the sleep. You just also mentioned it could be cycling or walking or treadmill. So each person has different body, let's say. One of them could be really heavily built, one could be a lean muscular person, or let's say a woman or a man. So how does one define that what is the right amount of exercise for them to keep themselves free from any cardiovascular diseases or, let's say, renal issues?
Very nice, because this is again like the treatment, this is an individualized.
Yes.
To give me a simple example, I never like going for a walking in the outside of my house. So I prefer treadmill. Dr. Anupama being busy, she may not be able to look into the other parts, as I said, cycling, swimming,
Walk.
going to gym. She will like to go for a walk.
Walk, absolutely.
Dr. Narendra 24/7 always on call, being a cardiologist. He will find a slot to do some kind of exercise of his choice. So it is like our food and nutrition, it's our own preferred way of doing the exercise. But basic rule is, if it is walking, minimum 45 minutes,
Okay.
5 days in a week.
Okay.
Same thing applies for jogging, cycling, swimming, at least 5 days in a week. No excuse for 5 days. Remaining 2 days we can tell excuse. This is an American style.
Okay. And
They
for Indian
want to
bodies?
make you free in weekend. Let
Yes.
you enjoy.
Yeah.
I also agree. See, if you become very strict, people will not follow. If you give some lenience, they will love you.
Absolutely.
They will follow you. Then added to this, there is something called as cardiovascular fitness exercises. So all these things which I have told will not give cardiovascular benefit. For that you have to do strengthening exercises. This is exactly today in all metros, gymnasium is available for 24/7. So even midnight you can go to a gym in a metro. May not be in a place like Shimoga. Why? People are now convinced that apart from regular exercise, there should be a cardiac fitness exercise, which is nothing but strength bearing or strengthening exercises. So if you have just 2-3 kgs dumbbell while watching a Netflix, we can do marvel for your cardiovascular fitness. Same dumbbell, we can keep it on the ankle and do the exercise. And apart from that, there are many stretching exercises which one can do on the floor with a mat, and that completes the fitness part of cardiovascular system.
Got it.
And burning the calories to burn the sugars.
Yes.
So physical activity is a must. So he asked for the quantum. It is very
45
clear.
minutes,
45
5 days.
minutes, 5 days in a week. Remaining 2 days, don't go for binge alcohol or food. No, you are only off for the exercise. That's all I want to tell.
Awesome. Thank you so much, Dr. Ratnakar, for giving us an insight and giving us a ballpark number on how many minutes one should exercise. Because when you speak about exercise, not everybody might be aware on what is the right amount of exercise. So once again, thank you for the same. Now, ladies and gentlemen, as you all know, we have the 3 industry experts over here. But doctors, before we wrap up, we would like to ensure that our listeners get one piece of advice on how one can take care and ensure that they are free from CaReMe diseases. Starting off with Dr. Narendra Ji.
I insist that we should be healthy citizens of a healthy country. So in that background, of course, we have we have contacted almost several aspects of the CaReMe diseases, how one can lead to another disease and all. So keep your heart, kidneys and your metabolism in a healthy state by what all we have actually mentioned so far.
Superb. Thank you. Thank you so much, Dr. Narendra, for giving us those amazing insights on what CaReMe diseases are, or how one can ensure that they have good cardiovascular protection to ensure that they do not face any issues in the future. So thank you so much, Dr. Narendra.
Thank you.
Now, moving on to Dr. Anupama. So, ma'am, your piece of advice for our listeners.
I would like to advise that you cannot be in a state of denial. Kidney disease is common, is preventable if you come early. So please consult the physician or your regular family doctor and get evaluated for kidney diseases at least every year. If you are a diabetic, if you are having hypertension, don't wait for problems to occur. And if you do find some abnormality in the test, please do consult the nephrologist. Another important advice which I missed out all this time is don't do self-medication. Don't take over-the-counter medication, and as far as possible, avoid painkillers or avoid some medications for long term without doctor's advice, which can harm your kidneys. And also you have to avoid some certain products like very, very high protein diet. Sometimes people are in the habit of taking a lot of proteins. Once I had a patient who came with the saying, I eat about 8 to 10 eggs per day. That is really high protein diet and that is not required. Stick to balanced diet, and that should you will be able to avoid the kidney diseases.
Okay, thank you so much, Dr. Anupama, for giving us very detailed insight and throwing some light on what the renal issues are and how one can avoid them and how one can protect themselves from having any issues in the future. So thank you so much, Dr. Anupama. And last but definitely not the least, Dr. Ratnakar, as a metabolism and a diabetes expert, your advice for our listeners.
It's definitely very, very simple. As I told earlier, the total motto of every human being present day situation is self-care. Don't depend on anybody, even for your health purpose. So self-care is the best slogan. Go for periodic screening according to your doctor's advice. Never believe social media experts or universities' advice telling that this can be cured, that can be cured, and you can be made 25 years from 65 years age. You will make you young, you will cure your diabetes. Please don't believe. Believe your own family doctors. And best part is, I am always interested in community health, prevention of the diseases. So we should not end up with CaReMe diseases at all. India should not have CaReMe crisis at all. It is already there. Let us see whether we can work towards better future of young India by preventing diabetes, by preventing kidney diseases, by preventing heart attacks, or even preventing blindness, which is one of the commonest eye complication of diabetes. So at the end, I only fold my hands telling that Sarve Janaha Sukhino Bhavantu. Let all be very happy and healthy. Thank you very much.
Thank you. Thank you so much, Dr. Ratnakar, for giving us such wonderful insights on how one can ensure that they can take care of their metabolism and ensure that they can maintain their diabetes not to spike up. So once again, thank you so much, Dr. Ratnakar. So ladies and gentlemen and all the listeners, that was Dr. Narendra, Dr. Anupama and Dr. Ratnakar for you all. Once again, I thank all of you for giving us your precious time amongst your busy schedule and giving your best of insights and best of advices to our lovely listeners. So thank you so much, doctors. And for you all listeners, your health is in your hands now. Make it or break it, it's completely on you. Take small changes one step at a time. Make some small changes like our doctors advised over here, and I'm sure you will see a big change in your lifestyle. And not just this, focus on your CaReMe health and do ensure you follow the advice what our doctors just mentioned. And also, I hope you're making a note of the test that they're mentioning if you want to ensure you have a wonderful future. So stay healthy, stay fit, amazing time. Until next time. Thank you.